Conversation.
What's the problem?
I have a terrible pain in my feet, the joints of my toes and knees.
Okay, please sit here. I'll check.
What's the trouble, and is it so serious?
Please calm down. How long have you had this pain?
About 2 weeks. I feel it hurts very much when I stand, and some nights I can't sleep because of the severe pain.
Yes, and I notice your toes are a little bit red and swollen. Have you had this problem before?
No, I've never had this problem.
Do you drink alcohol?
Occasionally.
Do you often eat meat?
Normally I always eat chicken.
Okay. According to your symptoms and your personal information, you seem to have gout. But we have to make an examination to make sure. Please don't worry about it too much. You have to take care of yourself more and follow my suggestions.
Certainly, doctor. Conversation. Yesterday, I played basketball, and when I shot the ball, the lower part of my back hurt very much. And when I walked, I felt the pain shoot to my legs.
Okay, let me check for a moment. Do you still feel pain right now?
Yes, especially when I move. And sometimes I feel my legs numb.
First, I will give you a painkiller to relieve the pain.
Okay.
I suggest you lie on something hard, such as a mat on the floor. It can make you feel better. You can apply a cold compress for 1 or 2 days, and if the pain has diminished, it is better to apply a hot compress. Try not to move too much.
Okay. I will do as you suggest. Thank you. Conversation. I have a pain in my arms and my finger joints.
How long have you had the pain?
About 1 week.
How do you feel when I press here?
Ouch! It hurts very much.
Oh, I'm sorry. I just want to check it. Have you played any sports recently?
Yes, I played karate last week.
Okay. And have you had any injuries before?
No, I haven't.
There is nothing to worry about. I'll give you this cream. Apply it after taking a shower every day. And this is a painkiller. Take it when you have pain. Don't do anything strenuous.
I see. Thank you. Conversation.
What's the matter?
My shoulders hurt and are very stiff. Sometimes I can't sleep because of the terrible pain.
Okay. Does it hurt all the time?
Yes, especially when I stretch my arms.
What kind of work do you do?
I'm a programmer.
You have to sit in front of the computer for a long time in a day, right?
That's right.
Many people who do this kind of job have this problem. You should take a rest at least 15 minutes every hour while working.
I see. What should I do when I have a severe pain?
I will give you a painkiller, and you should do light shoulder exercises. It can make the pain somewhat relieved.
Okay. And can I apply a cold compress?
A hot compress is better. If you still have the pain, please come again.
I know. Thank you very much. Conversation. Doctor, I can't move and turn my neck. It's stiff and hurts.
How long has it been hurting?
This morning when I got up, but I didn't do anything that hurt my neck.
Do you have pain anywhere else?
A little bit in my back.
I guess it occurred because of doing some activities.
Yes, I remember last night I had a nightmare.
I'll give you this gel. Apply it on your neck and back every night.
How long will it take to go away?
About a week. But you have to be careful and don't move your neck too much.
That means I can't do anything strenuous for a week, right?
That's right.
But I have a football match on Friday. Is there a better way to make me get well sooner?
I have to say sorry. With this ailment, you have to be patient and wait to get better.
Okay. Thank you. Conversation. Please help me, doctor. I have broken my arm.
Okay. Please don't move. When and how did it happen?
A moment ago. I fell from a stepladder while I was fixing my house roof.
Your bone is sticking out. Do you have pain anywhere else?
I have a pain in my hips, my bottom, and my knees.
Calm down and relax yourself. I will help you. You have to stay in the hospital for about 3 days. After your arm is better, we will x-ray where you have pain again to make sure that there is no bone fracture.
Okay, doctor. Conversation. I have sprained my ankle while I was jogging.
There might be internal bleeding. How does it feel when I touch it?
It hurts very much, doctor.
Okay, I will bandage it. It might be inconvenient. You have to be patient.
Yes, and when can I take it off?
You have to put up with it for about 1 week.
Can I take a bath?
Of course. You can apply a cold compress for a few days. After that, applying a hot compress is better. You should not try to move the injured part.
I see. Thank you very much. Conversation. I feel like there is something wrong with my knee.
Let me check. How does it feel when I press it?
It quite hurts, but I can tolerate it.
It seems to be dislocated. Did you kick anything?
Yes, yesterday I played football and I fell down. First, I thought it was all right, but last night I felt it hurt when I walked and moved, and there was a bruise on my knee.
Okay, this is going to hurt a little, so please bear it.
Okay, I think I can put up with it.
Now it's back in place. Is it still painful?
It's better, but I still have a little bit of pain.
Don't worry. I will give you some painkillers. If you are not careful, it can happen again. And you have to give up playing football for a while.
Oh, that's very bad, but I'll do as you suggest. And when will it go away?
In about 3 weeks.
Conversation. Doctor, I got a crick in my neck when I got up this morning.
Does it hurt much?
It hurts when I try to move and turn my head.
You should not try to turn your head if it's not necessary. But if you have to, you should do it slowly and carefully.
Yes. When will it go away?
It will go away by itself in a few days. I will give you a painkiller.
Can I take aspirin?
Yes, you can.
Can I massage it or apply a compress?
You can massage it gently, and you should apply a hot compress.
Okay. Thank you very much. I'll do as you say. Conversation. I cut my finger with a sickle while harvesting rice in the field.
Let me see. Did you sterilize the wound?
I only rinsed it with water, but it didn't stop bleeding.
Was the sickle rusty?
I don't think so.
The wound is quite large. I have to suture it.
Wait, doctor, will it hurt?
I'll give you a local anesthetic, so it will not hurt. But it will hurt for a while when the anesthetic has lost its effect.
All right.
You have to be careful when you take a shower. Try to keep the wound from the wetness, and don't drink alcohol until it heals.
I see. When do I have to come again?
I will take the stitches out, so please come again in 7 days.
Okay. Thank you very much. Conversation.
What's the problem?
I think there is something wrong with me. I bleed when I have a bowel movement. I'm afraid I'm having hemorrhoids.
How long has it been?
3 days.
Have you been constipated lately?
No, I'm normal, I think.
Do you have pain when you have a bowel movement?
Sometimes.
I'll give you some medicine. If you feel it's not better, please come again.
Do I need surgery?
We will talk about that again if your conditions are not better.
Okay.
Don't sit for a long time and keep your anus clean. And don't carry or lift heavy things.
Thank you very much, doctor. Conversation. I feel like I have a cold.
What symptoms do you have?
I have a cough, a throbbing headache, a sore throat, and the chills.
Have you vomited?
Yes, I vomited this morning.
And do you have a runny nose?
Yes, and my nose is blocked.
Please sit here. I will take your temperature. It is 39 degrees centigrade. You have a fever too. And let me check your throat. Open your mouth, please. Do Do you have trouble when you swallow?
Yes, it's quite hard to talk and swallow.
Do you cough up phlegm?
Yes, I do.
Your throat is swollen and inflamed. You should not drink cold water or alcohol. I'll prescribe some medicine for 4 days. Please rest and stay in bed today.
How long will it take to recover?
About 4 or 5 days.
I see. Thank you very much. Conversation.
Please take a seat. What's the problem?
I have had a cold for 2 weeks. I came here and a doctor prescribed some medicine for me, but I didn't feel any better.
Do you have a fever?
Yes, I do.
How long have you had a runny nose?
2 weeks.
Okay, I'll take your temperature.
Okay.
Your temperature is 39 degrees centigrade. It's quite high. Do you have difficulty breathing?
Yes, I wheeze sometimes, and my chest hurts as well, especially when I cough.
You should stay in the hospital.
Oh, that's very terrible.
Don't worry. Please stay in bed and relax. I'll come to check again.
Conversation. I feel easily tired when I do anything. I don't have an appetite, I perspire, and I have a slight fever in the night while I'm sleeping.
When did you have your last checkup?
A few years ago. I rarely have checkups.
Okay. Have you ever coughed up rusty phlegm?
Yes, I have.
Have you ever had this problem before?
No. What's wrong with me?
I can't tell you now. Let's take an X-ray and thorough physical examination. When I have the results of the X-ray and examination, I'll tell you.
Okay.
You have pulmonary tuberculosis.
Oh? Is it serious? Is it possible to recover, doctor?
Please take it easy. You will get well soon if you follow my suggestions.
Yes. What should I do?
I'll give you some medicine, but if there are any side effects, please come again. You have to take care of yourself much more. One more thing, you should not smoke.
I see. How long will it take to recover?
About 6 months.
And do I have to come to the hospital regularly?
It's not necessary. You have to come just for periodic checkups.
Is the disease contagious? I'm afraid my family will catch it.
You have to keep your personal belongings separate, such as a towel and a glass. Anyway, you have to come to the hospital immediately for a consultation when you feel bad.
Okay. Thank you very much, doctor. Conversation.
What's wrong?
I thought I had a cold, but I have had a fever for several days.
What symptoms do you have?
I can't stop coughing, and I have a lot of phlegm.
How long have you had the cough?
About 3 weeks.
What color is the phlegm?
It is purulent.
Do you smoke?
Yes.
You must stop and give up smoking so that the bronchus heals faster and doesn't get worse. Besides, smoking is not good for your health.
I will try.
I will give you some medicine. You have to take a rest for at least 3 days.
Okay. Thank you very much. Conversation. I have been coughing for a long time.
Do you have phlegm?
Yes. When I cough, I get a lot of phlegm in my throat. It causes difficulty in breathing.
How long have you had this problem?
For 2 months.
Do you smoke?
I have given up smoking for a long time.
Okay. Do you have a fever too?
Not at all.
Do you use any expectorant?
Yes, I have used it for a month.
Does it help?
A little bit.
I think you should stop using it. I will prescribe something else for you.
Thank you, doctor. Conversation. I have terrible heartburn.
When did you start having this problem?
In the morning, after I had breakfast.
What did you have for breakfast?
I had papaya salad, red curry, and spicy sour soup with shrimp.
And what did you drink?
A bottle of soda pop.
Do you feel nauseous as well?
Yes, and my abdomen feels as if it were tightly squeezed.
I'll give you some medicine. If you don't feel better in a few days, please come again.
Okay.
You should not eat spicy food or drink anything too hot or too cold. And you should eat soft food, such as gruel, until the pain goes away.
I see. I'll do as you say. Conversation.
What's the problem?
I have a terrible stomach ache after having breakfast.
How long have you had the problem?
About an hour, but I feel the pain is worse when my stomach is empty.
Does it always hurt when your stomach is empty?
Yes, and when I drink coffee, it hurts.
Okay, I'll give you some medicine. You should not drink hot things or alcoholic beverages. Try to avoid spicy food as well. If you don't feel better in 1 or 2 days, please come back for further investigation.
Thank you very much. Conversation. Doctor, I have a terrible stomach ache.
Where does it hurt?
Somewhere around my belly button, and sometimes it hurts on the right.
When did it start to hurt?
This morning.
How does it feel when I press on the right side of your abdomen?
It hurts very much.
Are you constipated or do you have a fever as well?
Not at all.
Let's take CT scans to see if you have appendicitis.
Okay.
According to the results of the CT scan, You definitely have appendicitis, so you have to have surgery. You should not eat anything before the surgery.
I'm so stressed about the surgery.
Please take it easy. It's not as bad as you think. You will recover after the surgery.
Conversation. I don't know why I feel nauseous after eating, and I have had terrible diarrhea for 3 days.
Did you vomit?
Yes,
Do you have a temperature?
just a little bit.
Do you remember what you had eaten before you had the problem?
I had a party with my friends 3 days ago, and we ate many kinds of food.
Did your friends get this problem like you?
No, it was only me.
Okay. And have you been taking any antibiotics?
No, I haven't.
Okay. You had better not eat anything today, apart from electrolyte replacement, until you feel better. Then you can have some liquid food.
Okay, thank you very much. Conversation. I'm dizzy and weak from having diarrhea several times. I also have a chronic stomach ache.
How long has this happened?
2 days.
It seems like you have a fever as well.
I think so.
Was there blood in your bowel movement?
Yes.
Okay, I'll take your temperature. You have a fever too. You should avoid alcoholic and cold drinks and spicy food. Try to avoid psychological stress. I suggest you take food high in protein and vitamins.
So, what's wrong with me? And is it serious?
I'm afraid this disease is quite serious, but not fatal.
Conversation. I suddenly have a terrible stomach ache and vomiting. The pain is worse when I cough or breathe deeply. Sometimes it hurts below my ribs on my right.
How long have you had the pain?
About 1 day. I hiccup and I have a fever too.
Please lie down here. I'll examine you.
Okay.
You seem to have peritonitis. Let's take an X-ray to make sure.
Okay.
You have to have an emergency operation.
Oh, right now?
Yes.
Conversation.
What's the problem?
I feel a lack of energy and my whole body is tired.
Do you have a fever?
No, but sometimes I feel like vomiting.
How about your appetite?
I have had no appetite for a while.
Have you ever felt this way before?
No, I haven't.
And did you notice the color of your urine? Was there anything different?
Yes, it was quite dark.
You seem to have acute hepatitis and jaundice as well. Don't worry, it doesn't seem to be serious.
What should I do then? Do I have to stay in the hospital?
No, I'll give you some medicine to help relieve some of your symptoms. Anyway, if you don't feel better, please come again.
Okay, thank you very much. Conversation. Good morning, doctor. I've come here for a consultation about my health.
Good morning. So, what's wrong?
I feel very tired and I lack energy to do anything. And I also have no appetite.
Do you have a pain somewhere or a fever?
I don't have a fever, but I have a sharp pain at the upper right side of my stomach. Sometimes my stomach feels distended.
Okay. Do you drink alcohol?
Just occasionally.
Are you taking any medicine?
Yes, I always take some digestive aids after a meal.
You have to refrain from drinking alcohol. You will have to come to the hospital regularly for a while until your conditions are better. Try to avoid strenuous activity.
Will I be able to get well soon?
You have to be patient for a complete recovery. I'm not sure how long it will take. It may be 4 to 6 months.
Okay, I understand. Thank you very much. Conversation. I feel languid and I have no energy to do work or anything. I also have no appetite because whatever I eat is tasteless. I sometimes feel like vomiting.
How long have you felt this way?
A few weeks.
Do you feel a loss of sexual desire?
Yes, I thought it was because of the tiredness.
Do you drink alcohol a lot?
Yes, especially when I go out with my friends.
Okay, let's take a CT scan to make sure.
Okay,
I'll tell you when I get the results of the imaging. You have to give up drinking alcohol. You should have nutritious food high in protein and vitamins, such as vegetables and fish. It's important for you to take good care of yourself and relax sometimes.
how long will it take to get well?
I'm not sure. Anyway, you should follow my instructions strictly and be patient for recovery.
Conversation. I have a sharp pain at the right side of my abdomen. Today I even began to have a pain in my back and my right shoulder.
When did you start to have this trouble?
Since last week.
Do you have pain anywhere else?
No.
Do you feel nauseous?
No, but my stomach feels distended and swollen.
Have you been eating greasy food a lot?
Yes, I like fried food very much.
You may have gallstones, but let's take an X-ray to make sure.
Okay.
We will talk about this again when I have the results of the X-ray. Please come again tomorrow.
If I really have gallstones, do I have to have surgery?
I can't give you any conclusions until tomorrow.
So, what should I do if I start getting the pain again?
I'll give you a painkiller. You can apply a hot or cold compress when you have severe pain. It should be better. And you should avoid overworking because it can cause pain.
Okay, I'll follow your instructions. By the way, I still worry about the operation.
Take it easy. Today we have very good medicine maybe you don't have to have surgery.
Really? I feel better to hear that. Thank you very much. I'll come again tomorrow then. Conversation.
What brings you to see me today?
I feel there is something wrong with me, so I came here.
Okay. Please describe your problems.
I don't feel very well. I feel nauseous and I often urinate during the day.
Do you break out in a cold sweat?
Yes, and I have suddenly started to gain weight.
Do you feel dizzy?
Yes, especially when I stand up. My vision has been getting worse as well.
Do you have pain anywhere?
My whole body aches and my hands and feet are numb. I also often have boils.
Do your hands shake?
Yes.
Have you ever received treatment for diabetes before?
No, I haven't.
You seem to have diabetes.
That sounds very bad. What should I do, doctor?
Don't worry. Just follow my instructions and the treatment given by the hospital. You will improve soon.
Conversation.
Good afternoon. What's the problem?
Good afternoon. I feel uncomfortable when I have a bowel movement.
How?
I pass blood. My stomach feels bloated and rumbles. I have been constipated for 4 days.
Are you often constipated?
Normally not.
Have you ever had abdominal surgery?
Yes, I had an appendectomy 2 years ago.
Okay, let's take an X-ray. Just follow me this way.
Okay.
We will talk about your problem again after we have the results of the X-ray.
It seems very serious.
Don't worry. Please relax. Everything will be okay.
Conversation.
Is there anything wrong with you?
I have a problem with my urine. I urinate much more frequently than normal.
Do you have pain somewhere?
Yes, I have a sharp pain around my bladder and near my kidneys.
What color is your urine?
It's orange, and sometimes it's pink. And it takes longer for the urine to come out when I have to urinate. That makes my abdomen painful.
Do you often get up to urinate in the night?
Yes, about 5 times.
Do you notice any dripping after the urinating?
Yes, there seems to be blood and pus.
You may have an acute inflammation of the urethra or a venereal disease such as syphilis. Let's make an examination.
Conversation. Doctor, please help my son.
Please calm down. What's wrong with him?
There is a lot of prickly heat on his body, head and face. It seems to be very itchy. He scratches and cries all the time.
How old is he?
He's 1 year old.
Is he allergic to anything?
No, I don't think so.
Okay, let me see.
Okay.
It seems to be eczema.
Is it serious?
Don't worry. This problem occurs amongst babies. I'll give you a prescription.
Thank you very much. Conversation.
What's the problem?
Recently, I have had difficulty breathing. I notice my face, fingernails, and lips are so pale.
Do you feel easily tired?
Yes.
Have you lost weight?
Yes. It's because I have no appetite.
When was your last medical examination?
6 months ago.
Okay, let's make a thorough examination to be sure.
Okay. Conversation.
What's wrong?
My daughter has a fever and her tonsils are swollen.
Okay, please tell her to sit on the chair.
Okay.
Let me check. Please open your mouth wide, little girl. Is this the first time for her to have this trouble?
No. She has this problem twice a month. What's wrong with her, doctor?
She certainly has tonsillitis.
Is it serious?
It doesn't seem to be serious. I'll give some medicine for her. Give her 3 teaspoons of this medicine 4 times a day. If she is not better, please come again. And if she has a high temperature, rub a wet towel over her body and then dry her. It can relieve the fever.
Okay. I'll do as you say. Thank you very much. Conversation.
My son is 1 year old, but he still has jaundice.
Is his bowel movement usual?
I think it's normal.
And what color are his stools?
They are gray and quite black.
Do you breastfeed him or give him formula?
I don't have enough milk, so I also give him formula.
Okay. He needs a thorough examination.
Is there anything serious, doctor?
I can't tell you anything until we have the results of the examination. Please take it easy. Conversation. I have a stomach ache and my stomach feels bloated.
Do you feel nauseous now?
A little bit.
Are there any other symptoms?
Yes. I found that my lips and my tongue are very dry.
Okay. You should drink a lot of water.
And what about food? What should I eat?
You should eat liquid food until you feel better. I'll give you a prescription. The pharmacist will tell you how to take the medicine.
Okay. Thank you very much. Conversation. I have pain on many spots of my body.
Where does it hurt?
At the joints of my knees, ankles, elbows, and wrists.
Anywhere else?
No.
How long have you had this pain?
About 2 months.
I want you to take a physical examination.
Of course, no problem. Conversation.
What's the matter?
My daughter often goes into convulsions. I don't know what to do. What's wrong with her?
Please take it easy. Does she have a temperature?
No. When she goes into convulsions, her face is very pale and her eyes roll back. What's the best way to help her? Should I give her some medicine to prevent convulsions?
I don't recommend that just yet. And does this happen many times a day?
Yes, about 3 times a day.
Okay, you should take her to come to see me.
I see. Conversation. There is a rash on my son's body, and he has a cold as well.
How long has he had it?
About 2 days.
Does he have a cough and a runny nose?
Yes, he does.
He seems to have measles. Are there any children with measles in his class?
I've heard that his friend was absent last week because of measles.
Okay. You should keep him warm if he has a high fever, but don't let him get too hot.
Can I give him some medicine?
Yes, you can give him paracetamol for fever.
How long will it take to go away?
He should stay in bed for about 3 or 4 days until the rash goes away.
Is it contagious?
It would be better if you kept him isolated until he recovers.
And should I take him to see you regularly during recuperation at home?
It's unnecessary, but the disease can cause inflammation of the ear and pneumonia. So if there is anything unusual, please bring him again immediately.
Conversation.
I don't know what's wrong with my daughter. She has little spots all over her body.
Does she have a temperature?
A little bit.
Let me see the rash. The lymph nodes under her arms and at her neck are swollen. It seems to be German measles. Does she have a cold and a cough as well?
No.
Are you pregnant?
No, I'm not. What's the problem?
I just want to know because it would be very bad for the baby to get German measles, unless you had German measles already. Have you had German measles before?
Yes, I have.
It would be all right if you are pregnant then.
So, when will she recover?
Don't worry. It just takes about 2 or 3 days.
Okay. Thank you very much, doctor.
Conversation.
My son has a terrible rash.
Where does he have it?
On his chest, tummy, and hairline.
Let me see. Does he have any blisters or black spots somewhere?
Yes, but they seem to be forming scabs.
When did the rash appear?
3 days ago.
Does he have a fever?
He has a fever on and off.
Okay, he seems to have chickenpox. He should stay in bed for at least 3 days. Then he will recover naturally. You should not allow him to scratch because it will leave scars.
And is it contagious?
Yes, it is. If he has sisters or brothers, you should keep them separate.
Okay, I understand. Thank you very much.
Conversation. What's the matter?
My sister's cheeks are swollen and painful.
Can she open her mouth?
When she opens her mouth, it hurts, especially the area below her ears.
Does she have a fever?
No.
And does she have a stomach ache?
Yes, sometimes she does.
She seems to have the mumps, so she should take a rest until the pain is gone.
Should I give her some medicine to relieve the pain?
You can apply a wet compress to her neck and give paracetamol. It will relieve the pain, and you should not give her anything sour to eat. It will aggravate the pain.
Okay. I'll do as you say. Thank you very much.
Conversation.
Doctor, there is a rash that looks like prickly heat around my son's chest and neck.
Let me see. Does he have a fever?
Yes, he does.
When did the rash appear?
Yesterday.
Did he scratch?
Yes, I think it must be very itchy because I see him scratching the skin all the time.
Does he have a sore throat as well?
Yes, he can't swallow anything, but he can sip water.
Did his tongue look white after the rash appeared?
Yes, and I see red spots on his tongue too.
Let me see it. Okay. It seems to be scarlet fever. I'll give you some medicine. He should have a complete rest for about 4 or 5 days until the rash goes away.
Okay. Thank you very much, doctor.
Conversation. Good morning. What's wrong?
Good morning. My daughter has been coughing for a month.
What symptoms did she have at the beginning?
She had a cold, a runny nose, and sneezing. Now she has gotten over her cold, but she still has a cough. She told me that her throat itched. She can't stop coughing.
Okay. Let me check her eyes. Oh, her eyes are bloodshot.
Do you think it's an asthmatic attack?
No, it is whooping cough.
Is it serious and can it be cured?
Don't worry. Today we have very good medicine for it.
Is it contagious?
Sure, it is. That's why all infants should have the DPT shot to prevent pertussis, diphtheria, and tetanus. Conversation. Hello, please take a seat. What's the matter?
Hello. I have terrible morning sickness.
How long have you felt this way?
For a week.
How far are you into the pregnancy?
1 month.
So you have to have enough nutrition.
Yes, I know. I try to eat as much as I can, but when I get smells of food, I feel like vomiting.
It's a normal problem that you have to face to become a mother.
Yes, but how long will it continue?
A little longer. I suggest you eat cold food. It will be better.
Really? And should I take medicine for morning sickness?
You may take certain medicine that is not harmful to the baby. I'll prescribe some for you.
Will I have enough nutrition then?
I suggest that you come to see me as scheduled and watch your weight. Call me if you lose more than 1 kilo.
Okay. Thank you very much, doctor.
Conversation. What's the problem?
There is something wrong with me. My temperature is a little high, and I feel like vomiting every morning.
How long have you had this problem?
About 2 weeks.
Have you missed your period?
Yes, it's been overdue for a week.
You might be pregnant.
Oh, really?
But let's check to make sure.
If I am really pregnant, my husband will be very glad.
Conversation. Hello, please take a seat. What's the problem?
I always have cramps a few days before my period starts. I don't know what to do.
Do you have a backache?
No.
Can you go to work when you have cramps?
Yes, but sometimes I have to take a sedative.
And do you have a headache or a fever as well?
Sometimes I have a headache, but I think it's because of stress.
Okay. And do you feel better when your period has started?
Yes, I feel all right.
Most women have this kind of problem, but your case is called premenstrual stress. I suggest you stop taking the sedative because it's dangerous, but treatment with hormones or other medicines would be better.
I'm okay then?
Yes, don't worry. I'll prescribe something for you. Please pick up your medicine at the counter.
Okay. Thank you very much.
My pleasure. Take care of yourself. Conversation. What's wrong?
My period hasn't started yet this month, so I've come here for a consultation.
Did your period occur on time every month?
Yes, I always have my period every 28 days.
So, when should it have started in this month?
It should have started 2 weeks ago.
Is it possible that you are pregnant then?
No, it's impossible.
Have you lost weight?
No, my weight is normal.
Any other abnormalities?
No,
What kind of work are you doing?
I work as an accountant.
Are you enjoying it?
Yes, I like it, but sometimes I'm so stressed about it.
How long have you been working?
Just 2 months.
How are you getting along with your colleagues in the office?
Yes, I get along fine with everyone.
So, do you feel strange in any way?
No, I think I'm okay.
Okay, don't worry. I think your menstrual irregularity is because of stress. You should relax sometimes and avoid psychological stress.
That means there isn't anything to be concerned about, right?
Yes.
So my period will return to normal?
Yes, if you do as I say. Anyway, if you have any problems with it, please come back again.
Okay. Thank you very much, doctor.
Conversation. I have a toothache, doctor.
How long have you had the pain?
About a week.
What kind of pain is it?
It's a piercing pain, especially when I drink cold water and eat something sour.
Does it hurt all day long?
Yes, I can't put up with it any longer. I have difficulty speaking and I can't eat anything. At night I can't sleep because of the severe pain. And today my cheeks are so swollen.
Please open your mouth wide. I'll check it.
Okay?
Okay. You have had a filling before, right?
Yes.
Okay, I see it. I think a filling has fallen out.
Do you have to pull out the tooth?
No, it just has to be filled.
That's very nice. Conversation.
What's wrong with you?
My gums are swollen and they bleed when I brush my teeth.
Do you have pain?
A little bit, but my breath is very bad and my tooth feels loose.
Do you brush your teeth every morning and evening?
Yes, I do it regularly.
Do you have diabetes?
No.
Do you have difficulty in chewing?
Yes, when I bite something hard, it quite hurts.
Okay. Open your mouth, please. I think this is because of vitamin deficiency. I'll give you some medicines and vitamins.
Thank you very much. Conversation. One of my back teeth is hurting.
Okay. Let me check. Please open your mouth. Ah, I see an impacted tooth is cutting through. Is this where it hurts?
Yes. Is it okay to keep it?
If it does not trouble you, you can keep it.
Will the teeth arrangement get crooked if it's pulled out?
We will take care of it well. Don't worry.
Please take care of the pain first at this time. And if I have any problem with it, I'll come to see you again.
Okay. I'll give you some medicine then.
Conversation.
I'm so stressed from these pimples on my face. They are very awful.
Let me take a closer look. Are you still in school?
Yes, I am.
I think it's the sign of your age.
I have tried to do everything I can, but it didn't work.
What have you done with it?
I have taken medicine and used acne cream from a clinic.
Okay. Do you usually wear makeup?
I want to cover up the spots left by pimples, so I often wear makeup.
The reason why you get pimples is because dirt, oil, and bacteria get into the pores of your skin.
What should I do then?
You have to use face lotion and powder that are not greasy. Greasy food can cause the pimples, so you should avoid it. Deficiency of vitamin B2 or B6 may also cause this problem, so you have to eat food that contains these vitamins.
I'll do as you say. And can I use acne cream or medicine that's sold at the drugstore?
You should consult a skin specialist about that. I think it would be better.
I see.
Anyway, you have to clean your face with this soap every day.
Thank you very much.
Conversation.
Please take a seat first. What's the matter?
I have athlete's foot on my left foot.
Let me see.
Please do something about it, doctor. It's very itchy. I can't stand it anymore.
Does it bother you all day long?
Yes, even when I work.
How long have you had it?
About 2 months.
I'll give you fungicides to put on it. One very important thing is that you have to keep your shoes and socks clean. Try to keep the fungus-infected area dry and clean. It would be better if you wear good ventilation shoes and socks. It will take a long time, so you have to be patient.
Okay, thank you very much, doctor, and I'll do as you advise. Conversation.
What's the problem?
I burned my hand with the iron.
When did it happen?
Yesterday evening.
Did you put anything on it?
No, I just cooled it with water.
Okay. Does it hurt right now?
It's okay for now, but it really stings when the wind blows on it.
I'll give you some medicine to put on it.
Will it leave a scar, doctor?
There might be a scar, but today we have a good way to cure it. So don't worry.
Yes, I think so too. Thank you very much, doctor. Conversation.
What's the matter?
I have a stuffy nose, and the mucus in my nose forms dark yellow crusts.
Does it smell bad as well?
Yes, it does.
How long have you had the problem?
About 3 weeks. What's wrong with me, doctor? Is this very serious?
Please calm down. You seem to have chronic rhinitis. I'll give you nose drops. Try using them first and see how it heals. If you don't feel better, please come to see me again.
Okay, thank you very much. Conversation.
What's the matter?
I have a runny nose, and my nose often bleeds.
Is it itchy inside?
Yes, I always sneeze when I breathe in dust.
Do you have a headache?
Yes, my eyes hurt too.
Let me check. They are quite sandy. When did it happen?
I have had this trouble for a long time, and it gets worse in autumn and spring.
You might be allergic to dust or pollen grain, or you might have allergic rhinitis. Let's investigate. Just follow me this way.
Okay. Conversation.
What's wrong with you?
I have pain inside my nose.
Do you have a runny nose?
Yes, I do. My nose is stopped up, so I have difficulty breathing and smelling.
Do you have a headache?
Yes, and I have phlegm in my throat.
Is the mucus smelly?
It's quite smelly, and it's dark yellow.
Okay, let's investigate.
Okay?
You have sinusitis, and I see a polyp in your nose.
Oh? Is it serious?
Not really. First, I will prescribe something for you. But if it doesn't work, you will have to have an operation.
It's a major operation, isn't it?
Yes, and you have to stay in the hospital for about 2 weeks.
Will everything be okay, doctor?
Don't worry. The operation is usually successful.
Conversation.
Hello, what's the problem?
Hello. I have a problem with my ears. I can't hear well.
Please describe your symptoms.
Yes. My ears feel plugged up, so I can hear myself speaking very loudly.
Does it hurt inside your ears?
Yes, it does. And my ears are ringing.
Okay. Do you have a sore throat?
No, I don't.
Let me check your ears. This is because of swollen adenoids.
What?
If the adenoids are swollen, it will cause hearing problems.
What is the best thing to do about it?
We have to remove it or your hearing will get worse.
I don't want to have an operation, but if it's the best way, I'll do as you say. Conversation.
Good afternoon. What's the problem?
Good afternoon. I have a sore throat, especially when I swallow.
Any other symptoms?
Yes, I have a cough and my throat is very dry. I feel as if something were in my throat.
Do you have a cold?
Yes.
Okay, let me look.
Okay.
It seems to be acute pharyngitis. I'll give you some pills and something to gargle with. You should rest and keep yourself warm. You can apply a hot or cold compress on your throat. It would help.
Okay, thank you very much. Conversation. Please help me, doctor. I have a sore throat and my voice is hoarse.
Do you have difficulty swallowing?
Of course, and I have difficulty speaking too. It hurts so much when I breathe deeply.
Do you have a cough?
Yes, the back of my throat is itchy.
Okay. Do you have a cold?
No, I don't.
What is your occupation?
I'm a teacher.
You seem to use your voice a lot, right?
Yes, I have many teaching hours in a week.
You seem to have acute laryngitis. So please don't overwork your voice during this time. Do you smoke or drink?
I don't smoke, but I drink a lot.
You should stop or give up drinking, or it may damage your vocal cords. Please take care of yourself much more. I'll give you some pills.
Okay, I'll do as you say. Conversation. My voice is hoarse, and I have a sore throat when I shout or speak in a loud voice.
Do you usually drink or smoke?
I sometimes drink, but I am a heavy smoker.
You should stop smoking. And what do you do?
I'm a singer.
You're a singer, so you have to take care of yourself and your voice much more, because you are at risk of having polyps on your vocal cords.
What's the best thing I should do about it?
You have to give up smoking, stay in bed and keep yourself warm. And you have to stay silent during this time. And I'll give you some medicine.
When will it get better?
In just 1 or 2 weeks if you take care of yourself well.
Conversation. Please help my son, doctor.
Please calm down. What's the matter?
There is blood in my son's nasal discharge.
Please put him on the bed. I'll give him a shot.
Okay. How long until he gets better?
In just a few days. Don't worry. It's nothing serious.
That's very nice to hear. Conversation.
What's wrong with you?
My eyes are fuzzy when I look at things close, but I can see things far away well.
Do you have a headache and do your eyes hurt?
Yes, and when I read something, I have to hold it far away.
You are far-sighted. You will have to wear glasses.
Oh, really? I see. Thank you. Conversation. When I look at things that are far away, they are blurry and doubled.
Do you have a headache?
Yes, and I often misread. I feel my eyes get easily tired.
Okay, let's do a test and check your corneas. Well, you have astigmatism. I think you should wear glasses for astigmatism.
That means I will be free from headache, right?
Yes, it will be better.
Conversation. I can't see things that are far away, but I can see close things clearly.
Do you have a headache?
Yes, I have had a headache for a long time. It's inconvenient for me to read because I always have to hold a book right under my nose.
Okay. Can you read what's written on the board over there?
No, I can't see it clearly. It's blurry.
Okay. What kind of work do you do?
I'm a proofreader.
That means you always read a lot, right?
Yes.
You seem to be short-sighted. Let's take an eyesight test. After that, I will give you some advice about wearing glasses or contact lenses.
Okay, thank you very much. Conversation.
What can I do for you?
My eyes are bloodshot and painful.
How long have they been red?
About 3 days.
Do you remember if something got into your eyes?
No, nothing got into my eyes.
Do they feel itchy?
Yes, and they were covered with a sticky mucus film when I woke up this morning.
Let me see. The whites of your eyes are very red, and the inside of your eyelids are swollen. Does anyone in your family have this trouble?
No, but my colleague at the office has conjunctivitis.
Okay. You seem to have contracted infectious conjunctivitis from your colleague. I'll give you some medicine and eye drops. You should not rub your eyes. Try to avoid the dust and don't stay in areas with smog.
Okay, I'll do as you advise. Thank you very much. Conversation. My eyes are bleary and watery.
Let me take a close look. They are very red. Do they hurt?
Yes, they hurt a lot.
This is because the ingrowing eyelashes touch and irritate the cornea.
How does that happen?
It's because the edge of your eyelid is curved inward.
What is the best thing to do?
You have to have surgery.
Conversation.
What's wrong?
My eyelid is swollen and red.
Is it painful?
Yes, I can't keep my eyes open because the eyelid is in pain.
Is it itchy?
Yes.
When did it become swollen?
About 3 days ago.
You have a sty. I'll give you an antibiotic. You should not rub or touch your eyes, and don't chew gum.
Okay, thank you very much. Conversation. My eyes are often bleary when I read a lot, and I have a pain in the back of my eyes too.
Do you have a headache?
Yes, and I feel as if there were a pressure on my forehead.
Do you always sleep late at night?
Yes, especially when I have a lot of work to do.
You should get enough sleep and don't overwork your eyes.
I see. Thank you for your suggestions. Conversation.
How may I help you?
I don't know what's wrong with me. Recently, I always get depressed when it rains, and I get angry easily. Sometimes I feel very lonely. I often cry and hit myself. I'm afraid that I will have mania or hysteria.
Please calm down. Look, everyone can feel this way because everyone has problems. Life is not a bed of roses.
That means everyone can feel in the same way like me?
That's right. Are you getting enough sleep?
I have insomnia, especially when I'm in trouble.
Bad situations can cause this problem.
So, what should I do?
You have to avoid psychological stress. Try to relax by doing something that can make you feel relaxed, such as listening to music, painting, or gardening. I'll give you some medicine. You have to take these pills before you go to bed every day, and it may take 4 to 6 weeks to take effect. Please come to see me again next month.
Okay. Thank you very much, Doctor. It's nice talking to you.